biggest thing most parents, coaches want to know, kids, is when can you get back in the game? Yeah, that's a good thing I think about going to a sports medicine practice who understand athletes is, mine, probably Dr. Mariscalco, our goal is to get them back as soon as we can, safely. And there's different things that we can do to help that along. So when do you go back? It varies. There are programs now with sports metrics where you can get people back a little bit sooner, especially if they're rehab beforehand. But then, this is the best case scenario here. 9 months out, AP tore his ACL, and the next year he, second leading rusher, that second highest total ever of rushing, 2,000 yards that season, and got the MVP. And then you have Derrick Rose. He tore his, 2012 he had his surgery. He's still not fully back. I think he's played 10 games in 2 years. He's on the USA team right now. They were practicing Tuesday night and they took him out from practice. So he's still not all the way there yet. He's a high-level athlete, and these athletes get the best physical therapy and post-rehab. The good thing about ACL rehab, you're usually doing it with a physical therapist, and they're very good at taking them through this step process. It's a team approach, getting these kids back to where they were. We mentioned bracing also. Almost all the studies show they don't really help prevent ACL. Again, more the alignment for the collaterals, but as far as ACL, if you're going to have an ACL tear, a brace is not going to stop 1,000 pounds of force going on your knee. This was a study, some literature says, all right, who goes back to where they were beforehand? A lot of studies used to say 90%. The NFL did a study, I think this was 2013, and 63% returned to play within 2 seasons after their injury. Dr. Mariscalco, I think he was talking about the 2013 American Journal of Sports Medicine, where 69% with high school and college athletes, 43% returned to the pre-injury levels, and also 1 in 4 suffered a second knee injury. This is high-level college athletics. So that's ACL, which you probably heard. So there's a lot of other injuries, a lot more injuries than concussions and ACLs that you deal with all the time. So when do you go back from these? A lot of it, I tell most parents, kids, let pain be your guide. Ankle sprains, different things like that. Again, the most important thing with your ankles is to rehab it afterwards. So many times we see re-injuries of an ankle, 4 to 6 weeks out, they're back in the field, they're on cleats, and they twist it again because they didn't rehab it. The ligaments are loose for a while, but if they rehab that ankle, you can get it strong again. You do see these, especially in college football, the dislocations. Again, what you worry about the most, well, first is getting it back in. But the reason you don't rush them back, essentially, the cartilage, you can damage your cartilage here, and you want to heal and get the shoulder strong again, because you don't want repetitive dislocations of a joint. It's not good for the cartilage. So that's why rehab is important for these dislocations. Overuse injuries, these kids are starting little, and they're playing year-round ball now, football, baseball. I see it personally the most in baseball, the kids with the elbows. My son plays middle school. 3 of their pitchers got medial elbow pain this year. It's because, if you ask their dads, they're playing on 2 travel teams, they're playing middle school, they're pitching, they're not monitoring their pitch count as close. Yeah, the middle school coach or high school coach, they're monitoring their pitches in a game. They might be throwing 70, 80, 100. But then the next day they go to a travel game and throw 60 to 80 pitches. That's all cumulative on these kids. Stress fracture is another common, again, repetitive. A lot of runners, track. You see it, basketball. And again, get them back to playing. You essentially let pain be their guide. You want to get them back when it doesn't hurt. Very common, especially with football or cleats, is turf toe. It's essentially almost sprained this joint right here. And most of that is dealt with time, letting it calm down. What I'll prescribe too is a carbon insert for their cleats. It kind of helps stabilize the joint. So again, all these, the best resource you can have, trainers, physical therapists, you know, we can all help get people back safely, and that's the goal here. So thank you.